The CEO of the largest public hospital system in the United States just said something that should make every nurse and every patient pause. Mitchell H. Katz from New York City Health and Hospitals said he's ready to replace radiologists with AI. Not assist, not support, replace. And he didn't say in the future. He said it could happen now if regulations allowed it. Let me ask you, would you feel comfortable knowing your scan was read by AI first? How would that make you feel? Drop it in the comments. When I read this, I felt it, because this is not just about radiologists. Not at all. This is about the direction of healthcare, and more importantly, who is being removed from it. We've already been watching this happen. First, the short staffing, then increased patient loads, then burnout becomes normal, and now replacement is being openly discussed at the executive level. Listen, do you think this is about improving care? Do you really think it's about improving care or reducing costs? Drop it in the comments. You let me know what you think. Because let's be honest about what AI offers hospitals. It offers speed, scalability, and cost reduction. Radiologists are highly trained, highly skilled, and expensive. And according to this discussion, replacing them could create major savings. That's facts. And that matters, because healthcare systems are businesses. Healthcare is quietly shifting from human expertise to operational efficiency. Now let's be clear and let's be fair. AI can be useful. I like AI. I use AI. It can assist with screenings, detect patterns, and help flag abnormalities. And in some cases, it's already being used to support radiologists. But that's not what this conversation is about. This is about replacement. Should AI assist doctors or replace them? You let me know what you think. If you're a radiologist out there, drop a comment and let me know what you think. Let me know if you've been using this. Because here's the part nobody's talking about. If a nurse makes a mistake, they're accountable. If a doctor misreads a scan, they are accountable. But if AI misses something, who takes the blame? The hospital? The software company? Oh, the physician who didn't review it? Or no one? Would you trust a system where accountability isn't clear? That's a hard pill to swallow, because this doesn't just affect today. It affects the future of medicine. If AI starts doing the first reads, new radiologists lose training exposure, clinical judgment weakens, and dependency increases. And over time, the system forgets how to function without it. There's a trust issue because patients still believe a human being is reviewing their care. But what happens when that's no longer guaranteed and no one clearly tells them? That's not transparency. That's a silent shift. Even in my content, I have to tell you if I'm using AI. Do you think patients should be told when AI is being used in their care? I mean, I do, but that's my opinion. And this is the part nurses will feel immediately. The same system that's been saying we can't afford more staff is now saying we're ready to replace them. Just food for thought. Is this why they've let the burnout happen, let the short staffing go, because they have a plan for replacing us? This isn't me being anti-technology. AI has its place in healthcare, but replacing critical judgment, that's a whole different conversation, because healthcare is not just data. It's nuance, it's pattern recognition, it's human context, and every human being is different. You can't automate all of that, because once one role becomes replaceable, it doesn't stop there. Radiology today, who tomorrow? Who tomorrow? So I want to hear from you. If AI replaces radiologists, who do you think is next? My content is not trying to put fear into you. It's not fear-based. This is awareness, because once systems prove they can replace one role, they don't stop. And this is where everything shifts.
Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.